I'm Dr. Mark Stickney, and welcome to Ask the Vet Live, presented by Good Charlie Energy. As always, over the next 30 minutes, we are going to talk about things happening in the area of veterinary medicine and things going on with Spay-Neuter Network. We will answer some questions that have come in ahead of time, and we will also be taking any questions that come in live while we are broadcasting. So happy New Year, everybody. This is one of my favorite times of the year because it is a chance to look back on what you accomplished the year before, where you didn't quite get as far as you wanted to, what worked well and what didn't work well, and you get to reevaluate and start fresh this year with new momentum and energy going ahead. And I would like to take a few moments to just say thank you so much to our incredible staff, volunteers, our donors, our community partners with the Spay-Neuter Network for making this past year possible. We did some amazing things. We had an incredibly successful year reaching out to pets and to people and the community and doing everything that we were able to promote wellness in all of those areas. We are very excited about the momentum that we are carrying from 2025 and are looking forward to doing even more amazing, bigger things here in 2026. So thank you very much to all of the people involved with Spay-Neuter Network. We all have a role to play, whether it's a big role or a smaller role. Well, I guess it's just like in acting. There's only small actors, no small, only small role. Well, there's something like that. At any rate, everybody has played an important part, and whether you think it was a gigantic part or not, it was a critical part to make the machine work. So thank you so much to everybody. We have some free vaccine clinics coming up. As always, our free vaccine clinics have free distemper parvo vaccines for dogs and free FVRCP combo vaccines for cats, and we will have other vaccines available at a very low cost. You can get all of the details on when and where these will be on our website at spayneuternet.org or here on this Facebook page. The clinic that we have coming up here the soonest is going to be our free vaccine clinic at Dallas Animal Services this Saturday, starting at 9 a.m. So if you have a new puppy or kitten or a new dog or cat that you got as a present a few weeks ago, getting it started off on the right foot and getting it vaccinated is one of the most important things you can do. If you need to do that, please take advantage of our free vaccine clinics. We have those throughout the year in all of our clinic locations up in Dallas and Fort Worth and Crandall and here in San Antonio where I am located as well. So check out our Facebook page or our webpage at spayneuternet.org to see when those are going to be. All right, so let's take a look at some questions that have come in for the new year and talk about things going on with people and their pets. So Emily has written in and says that she rescued a tiny kitten who has a few fleas, but he's too young for most flea treatments. I've been combing him with the flea comb, but I'm not sure if that's enough. What's the safest way to manage fleas on really young kittens without using products they're too small for? Well, that's a fantastic question because, we end up with these little puppies and kittens, and most of the flea treatments that are available are usually for 8-week animals or older. So if you have a really tiny little foundling that you have, those are not going to be safe for their little organs to process. Using a flea comb is a fantastic place to start. It gets the fleas off, it gets the flea eggs off if there are any, and it gets the flea dirt off of them. So that's a great place to start. The other thing that you can do that can help your little kitten is to give them a bath with Dawn dishwashing detergent. Just the stuff that you would hand wash dishes with. The same stuff that they use for the ducks and other animals when there's an oil spill. And you don't don't want to do this all the time because it can be very irritating to their skin, but doing it once will be just fine. It will kill any of the fleas that are on the cat, basically by making it so they can't breathe and they drown and they die. But it does not have any residual effect. So be aware that it will kill the fleas that are on the kitty, but it won't keep killing fleas afterwards. But if you have a really heavy infestation, that's a great thing to do one time, and then carry on with your flea comb until the kitten is old enough to start a monthly flea control regimen. And remember that flea control is one of those basic animal wellness things that we can do, and we have provided a few different options at Spay Neuter Network. So please bring your kitten in and we can take a look at things. We can get your vaccine started, and we can get those flea preventions and heartworm preventatives started for puppies as well. And it will be at a very, very reasonable cost for you. We have another, so I have a question that just came in here, and this question is, will my female stop spraying after she gets fixed tomorrow? I love that question. Okay, I'm going to assume that this is a cat that we're talking about, so spraying is a behavior that cats have where they basically are marking their territory, and they do that when they hit sexual maturity. So that's about 6 months of age for cats, and that's when they start to realize, hey, I'm the big cat on campus right now, and now I need to start letting people know that I'm in town. So they start spraying things. So if they have just started doing this, having them spayed or neutered will make a tremendous difference. The issue that we run into is that if they are older, if they've been doing this for a long time, it becomes a learned behavior, and they may still do it to some degree after they're fixed. So this is this is one of these things where you nip it in the bud as soon as you can to have the best effect. But getting them fixed will make a difference to some degree. It is important that if they do continue to do it, that you want to use an enzymatic cleaner wherever they are doing the marking, because that will not only clean the area, but it will also destroy the scent and the scent markers that they are using to think, hey, I need to come back and keep marking this place. So that is the answer. If this has just started, yes, it's going to make a tremendous difference. If this has been going on for a while, yes, it will probably help to some degree, but we may have to do some other things as well to discourage them from doing that further. Great question. And then how long, and then I have another question here about how long after a bath can you get a flea treatment, I believe is what the question is. And I will typically say that we want them to be nice and dry before we do the flea treatment. I usually will say wait 24 to 48 hours. I think some of the package inserts will say, you can do it as soon as 4 hours after a bath. And yeah, maybe so, but if we've got a bath, then I usually wait a day and then apply the flea treatment to them, just to make sure it all gets absorbed and none of it gets washed off or gets caught up in any kind of water or anything like that could interfere with it working. And I just think that works really well. Good question as well. These flea treatments, things like that, they're not free, right? So we want them to work the best that they can. So I'll wait 24 hours after a bath to apply, if that is possible. Otherwise, wait as long as you can before you apply it, at least 4 hours. Great questions. And then we also have another kitten question from Rachel, who has written in to say that she's rescued a small kitten who is a little dirty from being outside. I've heard mixed things about giving kittens baths. Is it okay to bathe him at this age, or should I stick to wipes or spot cleaning? I just want to make sure I don't stress him or make him cold. So those are great. Those are all great considerations. So unless your little kitten is just filthy. Looks like it just ran through the mud, splashing in the mud or something like that. Spot cleaning is the best way to go because they can at this age find that bath stressful, and they also can get really cold really fast, especially if you're in an area where it's cold right now. Here in San Antonio, I think it's 81 degrees outside right now, so it's ridiculously warm. But little animals can get cold very fast. So if you are able to adequately keep them clean with spot cleaning, and wipes, that would be the way to go for right now. All right, I have another question. Can a dog be over-vaccinated for parvo? I got a puppy and they never provided proof of vaccination. So parvo is a deadly disease to puppies, and it is one of these diseases that is generally very well prevented by vaccination. So I would say that the risk of giving them one too many parvo vaccines is much, much lower than the risk of them getting parvo. So I would not be concerned at all about boosting that vaccine as many times as is recommended. It will not hurt them. It can only help them, and it is considered a core vaccine for puppies because the parvovirus disease is so debilitating and deadly to them. So if you don't have proof, go ahead and get them revaccinated so that you know for sure. Good question as well. Okay, this is excellent. All right, let's see. Jenny writes in, and she says that she has a 9-year-old Labrador who loves to play fetch. Excellent. I was gonna, Labradors they're really, really good at that. I don't know that I've ever met a Labrador that doesn't want to go after something that you throw. Now, they may not always bring it back, but they'll sure go after it. But this Labrador is heartworm positive and currently on medication. Her little cousin came over and played fetch with her for most of the day, and she seemed happy and energetic at the time. Yes. Later that evening, she had significant difficulty getting up from a lying position. Should this be a cause for concern given her age and heartworm treatment? And what would you recommend I watch for or do next? Okay, so heartworm disease is definitely a disease where if we are currently being treated for it, we want to limit exercise, especially if we are receiving the injections, the fast kill method, because those in the case of a fast kill method, over the course of 2 months, all of those worms are dying and their little bodies are breaking up inside the animal's bloodstream, and the more active we are, the more likely those little worm pieces are to cause a problem. And that will typically present as respiratory distress. They're not able to catch their breath. They may have develop a nosebleed from that, and they tend to be really, you can just tell they're not doing well, that they're having a real problem. If we're on the slow kill method, then the odds are then we don't have to be quite as exercise restricted. So if we went and played fetch for the day, that's fine, and had plenty of energy. The thing that I would think about with your Labrador being 9 years old, that is definitely a senior Labrador. We would say that they're about senior at 7. Is that we probably have some degree of arthritis going on, and that is a very common disease in large breed dogs, especially in Labradors, and especially if they happen to be a little bit overweight. So I would definitely, if we're back to normal now, then I would say that is probably the most likely cause of what's going on. I would visit your veterinarian, and they can do a physical exam, see specifically which joints are the problem with their physical exam, and then there are options for pain control that can be used for arthritis in these dogs that will make them much more comfortable. I would also double check on how we were doing with the heartworms and where we are in that treatment schedule, and make sure that for this particular dog we're not overdoing it. Okay, I have a question that has come in here. An English bulldog that has ear infections. The vet gave her Apoquel 16 milligrams and an antibiotic, but nothing works. What else can we do for her? We can't find anything that works. All right, so welcome to the joys of owning an English bulldog, and they are just as great of a dog as they are. They are skin problem pets. They keep they will. It's always something with them in their skin. And one of the issues that they have with their cute wrinkly faces and wrinkly ears is that they often have what are called stenotic ear canals. And what that means is that their ear canals are just kind of tiny and crinkly, just like their ears are, and that allows bacteria and moisture to build up in there. Additionally, and when that happens, when it gets moist in there, bacteria and yeast overgrow, and that can be a problem. Another thing with bulldogs is that they tend to have allergies to the environment, things in the environment just like we do. When we have allergies, when I have my allergies, my eyes are itchy and my nose is runny. When dogs have allergies, their ears are itchy and their feet are itchy. So we can have multiple things going on. I can be allergic, so my skin's already irritated and inflamed, and then if I end up with a bacterial or a yeast infection on top of that, it just starts to compound itself, and it can be very challenging to get it under control. The Apoquel is a great drug for treating allergies, and antibiotics are great for initially knocking down any kind of a bacterial infection. The thing that you may consider doing that is pretty straightforward would be to get an ear cleaner, and you can get that at Petco, PetSmart, pretty much any pet store, an ear cleaner, and start to clean those ears out once or twice a week. And that ear cleaner, those usually have some medications in them that create a more acidic environment inside the ear canal, and yeast and bacteria don't like to grow in that. So it can help to reduce the bacterial and fungal load inside of those ears. So that may be something else that you can do. You may need to talk with your veterinarian about being referred to a dermatologist. And then another thing that your veterinarian may consider doing is doing an ear culture and seeing exactly what bacteria is growing inside those ears, because sometimes they can be bacteria that have become resistant to the antibiotics we typically use, and we have to kind of go to the next step with things. So unfortunately, there's not going to be an easy fix for your bulldog, but there are definitely things that can be done that we can kind of continue to investigate. So I would talk with your veterinarian about those things, and for the time being, I think doing weekly, bi-weekly ear cleaning may help, so give that a try. All right, another question is how do you get rid of a cherry eye? Okay, so cherry eye is actually a condition that is caused by a prolapse of the gland of the third eyelid. So your third eyelid, that eyelid that you can kind of see, that pink eyelid that goes across the dog's eye when they're getting sleepy, you'll see it kind of go across there. That contains a little gland in there that is necessary for tear production. Now, some dogs are born with cherry eyes, and they call them that because someone thought at one point that it looked like they had a cherry sticking out of their eyeball. So that's why it's called a cherry eye. And what that is that's that gland that has prolapsed in there, and once that gland is kind of stuck out there, it tends to stay stuck. So there are a couple of things that can be done. If this is a young dog, sometimes those can be treated with topical steroids that will cause the inflammation of the eyelid to reduce, and that third eyelid will go back into place. However, most of the time this requires surgical correction where that third eyelid is actually tacked back down into place where it belongs so that it doesn't prolapse. So one thing you don't want to do is go and grab a hold of that and tear that off, because that really messes up with their tear production and can create chronic eye problems that go on for a long time. So those are the kind of the options for that. Let's see here. And then follow up to our bulldog. The vet did a culture and also give allergy medicine over the counter with the Apoquel. Okay, so this is kind of getting complicated now. I might see if your veterinarian can consult with a dermatologist and come up with some other things that could possibly help with your dog, because this is probably a multifactorial thing, and it's probably going to take several different strategies to get it under control. Tara writes in and says, My dog just turned 6, and I am taking him for his yearly vet visit with vaccines in a couple weeks. At 6, is he considered a senior dog? When do vets start to do more tests because dogs are older? I am not worried but want to be proactive. What question should I ask since he is getting older? This is my first dog and I want to make sure I am doing everything right. He has always been healthy. Thanks in advance. All right, well, Tara, congratulations. You're doing a great job and you are wanting to stay ahead of any issues with your dog, and that is great. So dogs are typically considered senior at 7. That varies based on the size of the dog. Older dogs tend to become senior sooner because they don't live as long. Smaller breed dogs tend to live longer, so you can kind of push up that senior designation a little bit. But a good rule of thumb is that 6 to 7 years of age, our dogs are senior citizens. Because if we follow the old adage of a dog ages 7 years to every one of ours, they're in their 40s, 50s by that time, and that rule of thumb is not entirely exact, but it's a good place to start at any rate. So you're concerned about it. Your dog is old enough that I would be concerned about it if you are concerned about it as well. So this is the age where you're going to want to talk to your veterinarian about doing blood work and a urinalysis. So the blood work is going to consist of a complete blood count, and that's going to let us look at our red blood cells, our white blood cells, and our platelets, and make sure that all of those numbers are within the normal range. We're going to do a biochemistry panel, and that lets us look at our liver, our kidneys, our electrolytes, our blood sugar, and lets us see if we have anything going on like liver disease or kidney disease, and also make sure that metabolically everything looks like it's working okay. And then the urinalysis is important because the very first thing that happens when we start to get old kidneys is that they lose the ability to concentrate their urine. So your body is really amazing at conserving water. And when you're thirsty, that's when you pee, and you've got really neon yellow urine. If you're really thirsty, and if you've been drinking water all day, it looks like water is coming out when you pee. So, and that is because our kidneys do a good job of saying this is how much water our body needs, and if we have too much, we get rid of it, and if we don't have enough, we try to hang on to it. So as your kidneys age, you lose that ability, and so the first thing that will happen in a dog or a cat is that you'll see that they're not concentrating their urine, and you'll see that by checking a specific gravity on the urinalysis. So CBC, complete blood count, a biochemistry panel, and a urinalysis for our older dog to see where everything is. Also, you will want to talk with your vet about your pet's weight and if it's time to change to a senior diet. Senior dog diets tend to have less energy and be more fiber dense and less calorie dense, so that they will not start to gain weight. Metabolism slows down as we get older, and maintaining a healthy weight has been clearly shown to increase a dog's lifespan. So we want to make sure that we're staying at a good weight and feeding the correct food for that. Also, another thing that you'll want to talk with him about is if this is a large breed dog, is we want to start talking about arthritis and things that we may need to do to reduce the risk of that happening, or if it is going on already, to slow its progression. So those will be the big things that you want to talk about, and then kind of go from there, and being proactive, like most things. An ounce of prevention is worth a pound of cure. So the sooner that we can get on top of things, the better off we are. And kudos to you for doing that. All right. We have a couple of questions that have come in here. All right. So this question is that we have an 11-year-old, 120-pound shepherd. That is a big and wise dog. He started itching after going in the lake a few years ago. Took to the vet. He told me to give him Benadryl. He has no fleas at all. I've changed his food, etc. I'm wiping with anti-itch cloths and sprays. Is there anything else I can do? Okay, so we have an older dog, a large dog, and a few years ago he started itching. So he was started giving him Benadryl, no fleas, and you're using anti-itch cloths. So there are a couple of other things that you can do. If it's good that you have no fleas, you want to make sure that you're on your monthly flea prevention to make sure that we don't have any breakthroughs. If we have a dog that has flea allergies, one flea bite will drive them crazy, and it'll drive them crazy for quite a while. So we want to make sure that we're doing that. The If this is happening primarily after we go for a lake, to go to the lake or get wet, we're going to want to give them a nice bath with a soothing shampoo, and then we can also, another thing that you can do with them is give them an oatmeal rinse, and that also is kind of a shampoo, but you put it on them and you let it set for a little while, and that helps take out the itch. If things are more serious than that, you might want to talk with your veterinarian. There are other medications. If we suspect that we have allergies, there are other medications that can be more effective than the over-the-counter Benadryl. So that may be something that you want to consider as well here going forward. Okay, another question. I have a just turned 1-year-old Cane Corso Belgian Malinois mix, another big dog. What's the best age to neuter him as well as take him off puppy food? So, great question. The answer to the puppy food is now. It's time to take him off the puppy food now, because if we want to, puppy food is great for growing, and it has lots of calcium, lots of phosphorus, lots of energy. The issue is with these larger breed dogs that if they grow too fast, their joints actually won't keep up with their body weight, and that can cause them to end up with early age arthritis problems. So we want to get him onto a large breed adult food now. So over the course of the next week, transition him from that puppy food to the adult food. On day 1, mostly puppy food and just a few kibbles of the adult food. On day 2, a little less puppy food, a little more adult food, until you get through the week. And that will help keep us from getting any diarrhea issues here over the week as we make that transition. So now is also the best time to neuter him. There is some people are advocating for larger breed dogs to neuter them a little later, but 1 year is kind of the magic age, even if you follow that. So this is the time to get him neutered as well. So and at this age, it's going to be a really smooth procedure, and he's really not even going to know what happened. So that's the time. The time is now for all of that. Neuter him and change his food. Great question. And of course, here at Spay Neuter Network, we can neuter them, and we do a really good job, and it does not cost you hundreds of dollars. So there we go. Okay, let's see. I think we've got time for one more question before we have to go today. And here's another itchy dog question. Okay, Chad writes in and says, I've noticed my dog licks his paws a lot when we're sitting on the couch or winding down for bed. I don't see any redness or open sores, but it happens often enough that I'm starting to wonder if it's allergies, anxiety, boredom, or something else entirely. How do vets usually approach figuring out what's causing this? Okay, that's a great question, and you are exactly right. It can be all of those things or none of those things. So, what you're going to want to do, if you don't see any redness or open sores, that's good. So the first thing that you can do at home is if we're bored or we're anxious, is give them something to do. Give them a rawhide chew or a Kong toy. Those big rubber kind of look like pine cones, and you can put peanut butter inside of them, and give them something to do and see if that fixes it. If it does, fantastic. But if that's not the case, then I would definitely get a evaluation at your veterinarian. And what we're going to do is we're going to talk to you about when the itching happens. We're going to take a good look at the places where he itches and see if we see any subtle signs of there being chronic infection, chronic bacterial infection, trauma to the skin, anything like that. And then based on that, we'll make a plan if we think this is food allergies or environmental allergies, or where we need to go from there. So with that, we are going to wrap it up today. Happy New Year to everybody, and thank you for joining us at Spay Neuter Network's Ask the Vet Live in collaboration with Good Charlie Energy. Remember to check out the links in our captions for free access to chat with licensed vets anytime through Good Charlie Energy, a discount pharmacy, and please leave any of your other questions that you have so that we can talk about them next time. Thank you very much. Bye-bye.